Welcome to the MedSynapse podcast, where we delve into the latest advancements and expert insights in the medical field. I am your host, Dr. Simran, and today we have a very special episode focusing on surgical interventions for swallowing and voice disorders. We are honored to join we are honored to be joined by Dr. Shama Render, a highly respected ENT surgeon with over 2 decades of experience in laryngology and otology. Dr. Kovale is the founder of Voice of ENT Community Online, a specialized community addressing complex voice and swallowing disorders. She is a consultant at Kokilaben Dhirubhai Ambani Hospital, Mumbai. Dr. Kovale, thank you for taking the time to share your expertise with our listeners today.
Thank you, Simran. Thank you for having me here. More than happy to share whatever I can with you today.
So, moving ahead, let's start by discussing the latest advancements in surgical techniques for treating voice disorders. Could you walk us through some of the most significant developments?
Yes. When it comes to voice disorders, it starts right from diagnosis till the surgical intervention. So, if you consider diagnosis, we have come up with the most important part, which is stroboscopy, which gives you a real-time imaging in cases of vocal cord movements, vocal fold movements, and let us know what exactly is happening with the voice or what exactly is the pathology with the voice. We have developed multiple softwares which tell us different things about a voice, like pitch, whether there is roughness, whether there is how high or how low is the pitch, all these things. So there are different softwares which are developed. So these are different things which are used nowadays as a recent in case of laryngology. When it comes to surgical techniques, initially we used to have only cold steel. So what do you mean by cold steel is basically when you're using your normal instruments or microsurgical instruments to do the surgery. Now we can do the same surgery with the help of laser. There is also co-ablator which can be used in certain voice surgeries, not in every voice surgery, but in certain voice surgeries. So these are the developments which have happened when it comes to instrumental or what kind of things which we can use to operate on larynx. Lasers, as you think of lasers, there are lasers for office procedures and then there are carbon dioxide laser. Now the latest laser which has come up is a blue laser which is used in laryngeal surgeries. So there has been a lot of development and still there are multiple things which will be coming in case of so these are the different things which we can use for laryngeal surgery.
That's an excellent overview, Dr. Kovale. I am sure our audience will appreciate the detailed insights into these cutting edge techniques and technologies. From your experience, how have these advancements translated into improved patient outcomes in voice surgery?
So when you think about the outcomes, definitely laser has proved to be a boon for laryngeal surgeries because we can actually measure how much thickness you have to cut. There is less bleeding. The surgery is very precise. It's like a precision surgery where you remove only what is needed and preserve what you don't need to be removed. So you preserve the SLP. With cold steel surgery, there are certain things which can cause the loss of superficial lamina propria, which forms the most important part for the vibratory part of the vocal fold. So with laser, this has become a very important thing that we can do a very precise surgery as far as vocal folds are concerned. Hence, the voice outcomes, the vocal outcomes are very good because we are preserving what we need and we are removing only what is not needed.
So So now shifting our focus to swallowing disorders, what recent surgical innovations are making a significant impact in this area?
Swallowing disorders mainly is treated with swallowing therapy, but there are certain disorders which require surgical interventions, like if there is a Zenker's diverticulum or if there is a cricopharyngeal spasm. So when you talk about cricopharyngeal spasms, cricopharynx is basically the opening or upper esophageal sphincter. The cricopharyngeal muscle forms the upper esophageal sphincter, so it needs to open when the food has to go into your esophagus. So, because of stroke or some any other reason, if the cricopharynx goes into spasm, then we need to do a surgery. So, first intervention is we can either inject Botox or then we can do a cricopharyngeal myotomy, which can be done either externally or endoscopically. So, endoscopic is a recent form of swallowing surgery. Zenker's diverticulum is also done endoscopically. Endoscopically, we can clip the Zenker's diverticulum and make help the patient swallow. When it comes to esophageal reason for dysphagia, you can do something called as POEM, which is an endoscopic myotomy at the lower esophageal sphincter. And then there is something called as a Hiller's myomectomy, which is done for certain kind of patients. So these are the things which are being increasingly done right now, which were not done as they are frequently done today.
That's highly informative. The advancements you have mentioned could really change the approach to treating these challenges or challenging conditions more appropriately, or I should say, more precisely.
I would like to add one more thing. Sorry, I missed it. We also have balloons. We have esophageal balloons. So we can use balloons to dilate cricopharynx. In cases of radiation-induced cricopharyngeal fibrosis, we do use cricopharyngeal balloons. Even at the lower esophageal sphincter, or if there's a narrowing and there is a stricture of the esophagus, we can use esophageal balloons. So that is another advancement which you can say in terms of esophageal, in case of dysphagia or swallowing disorder.
So, moving ahead with so many surgical options available for voice disorders, what key factors should clinicians consider when deciding on the best approach for their patients?
When you're deciding what you have to do, first you have to consider your expertise. How expert are you? How well trained are you in doing that particular surgery with whatever things are available to you? So if it is a cold steel and you are expert in doing a cold steel, you should opt for cold steel. Because if you have an option of cold steel and laser, and if you are not well trained in laser, then it's always better to do a cold steel procedure which you are expert in or you are trained in and you're confident in doing that. So I would suggest the first thing is you should know how expert are you. Then second, once you are trained, if you are trained, then what are the options available to you and what are the lesions that is present on the vocal folds that you need to treat. So depending on these three factors, you have to decide which thing has to be used for your surgery. Either you use a laser, you use a co-ablator, or you use a cold steel. For example, if a patient has a papilloma, a recurrent respiratory papillomatosis, which is a disease where there are multiple papillomas on the vocal folds. They can be supraglottic or above the vocal folds. They can be in the trachea. This condition is a recurrent condition. So if you have such recurrent papillomatosis, then you have multiple options to use. Either you can use a laser, you can use a co-ablator, or you can use a debrider, which is also a newer technique which is used nowadays in labs. So if you have all these three and you feel that no, I'm good at laser, then you have to go ahead and use laser. If you feel no, I'm not comfortable using laser co-ablator, I will go ahead and I'm better using a debrider, I will go ahead and use a debrider. But if there is a vocal fold polyp and you have all these three options, you know that in vocal fold polyp, the vocal outcome, the voice outcome is very important. There, you cannot use a co-ablator. You even if you are expert in a co-ablator, you cannot use a debrider, even though you know that you're comfortable with it, because the chance of eating up more tissue, co-ablator has a bigger footprint. Even a debrider is going to shave off. It is not a precision instrument, like I said. So here the best choice will be either laser or a cold steel, depending on what. So this is how you have to define what you are going to use for that particular patient. So you have to design according to the patient, what issue the patient is having and what you need to treat and what you need it as an outcome.
So depending on case to case and the expertise
Yes,
the doctors hold or the
yes,
clinicians hold, they can decide onto what perfectly fits the patients.
absolutely.
So you have touched on advanced techniques. Can you elaborate on the benefits of minimally invasive surgeries for voice and swallowing issues?
So when you talk about minimally invasive surgeries, in voice and swallowing, most of the times they are minimally invasive only because we are doing endoscopic surgeries. Very rarely we do open surgeries. Like if you're doing a thyroplasty, we need to do an open surgery. So in case of minimally invasive surgeries, the advantages are the bleeding is less, the time required is less, the outcomes are faster, the patient gets discharged faster. So all these things help in a faster recovery of the patient. So that I would say that is a benefit of a minimally invasive surgery. I hope I'm clear.
Yes, definitely. I was just thinking that how minimally invasive techniques are actually helping patients heal
Yes,
better and as well as quick results and better patient outcomes. Patients would not be in a fears of having this surgery or maybe suggesting this surgery to someone else because patients keep on asking, when they refer someone. Because obviously, patients, when they talk to each other, they are like, I have been through this surgery. But if the outcome is great, definitely they're going to suggest it to someone else.
definitely, definitely.
So
Like yesterday only, I had a patient who had operated for a cyst, and he said, "Yeah, because he is improved. The same a patient from our building has also come to you for voice surgery." So that definitely happens.
So minimally invasive techniques are actually helping patients recover in a better way. And even doctors feel confident about their surgeries because they know that the outcome is going to be great. So, moving ahead, looking on to what emerging trends or technologies in surgical intervention should doctor be paying attention to?
We are talking about voice, right? And so when it comes to voice, the most of the things are very recent. Laryngology is a very young and nascent branch as far as otorhinolaryngology is concerned. And so we need to create a lot of awareness because patients don't feel that they need to go undergo surgery for whatever little bit change of voice, except for professional voice users. Most of the people feel, अरे थोड़ा सा तो आवाज में खराश है अभी ठीक है ना चल जाएगा types.
Yeah.
So that is not what it should be. Even if there is a little bit of hoarseness, you have to go and see a doctor because that can also be a cancer. So that awareness has to be there, that change of voice is not something thoda sa kharash. It is much more than that. If it is just thoda sa kharash, it's good for you, but let the doctor tell you that it is just thoda sa kharash and nothing else. Okay. So when it comes to the emerging trends of voice, there are the most important thing which is coming right now is the robotic. Okay. So the development of robotic hands for laryngology, it is not same like the robots which are available now because they have big hands. For larynx, they need longer and slimmer hands, and they need to be very precise.
Yes.
So there are these. This is an ongoing thing right now. There are certain robotic arms which have been developed, but in we've not. They're not full fledged in use right now. So that is the most important trend which we need to look after and get ourselves trained once it is there as laryngologists. But whenever you're thinking of a newer trend coming, instead of jumping directly into that, you have to first start from the basic. You have to know because these are all gadgets. If it doesn't work, what? You have to know your basic. You have to know how to do a surgery by cold steel, then lasers. So once you know this, then you go to the latest advancement so that you have the full bag of things with you and you can offer everything to the patient and they can choose what they want. Because for voice, most of the times, the most important thing patients ask is surgery laser se hogi na? Because that's the awareness that has been created now.
They consider laser to be the
Yeah, वो तो
ultimate
सब
benefit,
जगह पे yes.
for every
For
treatment.
every surgery, even for a nose surgery, the last surgery laser से होगी. So laser is considered as the instrument.
Gold
But
standards.
yeah, but they don't understand laser is a cutting instrument, so it cannot be used everywhere. So that is one thing.
So thank you for highlighting those trends. Staying ahead of the curve with these innovations will be critical for advancing patient care. So, Doctor, could you share a recent case study where new surgical methods led to a particularly notable improvement in patient outcomes?
Like I said, there is no, I cannot say about a new surgical method, but yes. So there was this young boy who had a stroke basically, and everything went well, but he had issues with his swallowing. So when he had issues with his swallowing, he had come to me in the clinic, and that's when the diagnosis helped us. Okay, this is the problem. So you have a cricopharyngeal spasm. Then we injected Botox in him, and he's absolutely fine now. He can swallow, he can do everything on his own. So diagnosis and then treating that particular condition is very important, as instead of just about recent advances or recent things or new innovations, it is about how to use what you know and the new innovations together and then come to a particular decision and give a good outcome to the patient is what is important, is what I think. So it's an amalgamation of everything, your knowledge, what is basic, what is new, what is patient's problem, and you create a patient specific thing and deliver it, and you will get a good outcome.
Definitely, because having such an experience, great experience in this field, and then looking onto the newer technologies would be a different approach. Because you're already into the basics, you have done so many surgeries, and now when you're using these technologies, it would be beneficial for the patient and as well as for you as well, because now you are on a better part because you get relief from all those old techniques and you get something new to be done on the patients. So that's again a very good thought that needs to be resonated across the globe, because yes, people miss on to the basics and they directly want to switch on to the newer technologies. So that is quite rightly highlighted by you that basics is always important.
Yes.
So moving ahead with this, thank you for sharing such information or real world examples. Like this provides valuable lessons and inspiration for other practitioners. Dr. Kovale, we greatly appreciate you sharing your expertise with us today. Your contributions have provided our listeners with a wealth of knowledge and practical takeaways. So before we wrap up, I would want you to actually give us a feedback of how your journey with MedSynapse has been, and how do you think MedSynapse is actually benefiting the medical community out there?
I This is the second
Yes,
podcast with MedSynapse. The first one was also great. And this was also a good experience for me. I love talking about voice and swallowing, so I always enjoy whenever sometimes I think I go overboard, or sometimes I just miss what I want to say because I'm so wanting to say so many things. But yeah, it's been a good experience, and I think it does help people to know what the latest is, to know what exactly is happening in the world, and so that they can also choose and decide what they want to do. I think that also helps the youth to know. I mean, the budding doctors, the young, I consider myself youth, but the budding doctors.
that's absolutely correct. There's nothing wrong in that. Now they are budding, and you are the youth. Yes, definitely.
So they also should understand what to go, where to go, how to look after. Like, I think we can also have one more thing where we can talk about how to go about and take laryngology as a specialty or a subspecialty.
Definitely. Since you mentioned that it's a very nascent or a new field that is emerging, so definitely doctors, because everyone is confused these days that what exactly they have to do. So this
Yes.
another podcast of yours would be giving a clarity to many practitioners who have completed their MD or maybe MS and now they want to do some other specialization. So this would be of great help.
Yes.
Looking forward to that podcast as well.
One more,
Yes, please.
one more thing I want to add is, as a laryngologist, the speech language pathologist and the swallowing therapist form a very important part of our life. We work as a team, so yes. So when it comes to outcomes, their therapy and their is also very, very, very important, and I definitely want to give credit to them. And I cannot just say that laryngology is only about ENT surgery. So it also, therapists also form a big, big part.
So, highlighting the holistic approach that we
Yes.
need to have, and again, we can have a podcast on that as well, because it is
Oh,
very important to know that what all other departments can help the patient and can improve the outcomes. So, you are the best person to speak about it because you have been experiencing this, and this is so great that you are actually promoting holistic approach. That's really great. So we would again want to have your voice on that as well.
definitely.
So before we wrap up, I would like to extend an invitation to our listeners. If you are medical practitioners with valuable insights to share and are interested in joining us on this platform, we would love to hear from you. Please contact us to discuss how you can contribute to future episodes of MedSynapse podcast. Thank you again for listening, and we look forward to bringing you more expert discussions in our upcoming episodes. And thank you to our audiences for tuning into MedSynapse podcast. If you found this episode beneficial, please subscribe and join us for more discussions on the latest in medical practice. Take care.